Hi and welcome. Today we are treating this patient with VSoft Lift PDO threads. We are using a VSoft Lift twisted thread. It's also called a screw thread as well. And if you can get a good look at that thread, you can see that the thread is actually wrapped around the needle. It looks sort of like a screw. And these threads are going to stimulate the most collagen out of all of the smooth threads that VSoft offers. And the reason for that is it does create a little bit more tissue injury upon entering the tissue, which will increase that fibroblast activity and in turn give us more collagen. So this is a thread that I tend to reserve for the patients who really need it. A lot of times people ask, well, if this produces the most collagen, why aren't we using it then on every single patient? And it is a little bit more difficult to place. You can see you meet some resistance as that thread slides into the tissue. So it requires a little bit more force in placing the thread, and it does tend to be more uncomfortable for the patient as well. And so usually I reserve it for more of my advanced cases. This patient in particular, you can see we are treating her Marionette lines. The oral commissures are sort of downturned in this case. And we're looking to really build some collagen there so that we can hopefully minimize the appearance of the downturned corners of her mouth. And the way that these threads work, again, is that they stimulate collagen and elastin over time. This is something that does take several months to see improvement. And so when you're choosing this as a treatment for your patient, just be sure that you discuss with them. This is going to be a very gradual improvement over the next several months. Collagen typically takes about 3 to 6 months to peak with our PDO smooth threads. And so the thread actually starts dissolving in about 4 weeks. And despite the thread being fully reabsorbed, we still will have that collagen that we've produced and maintain that collagen. Some people get 12 to 24 months out of it. What we do generally for our treatment approach is 1 treatment every month for at least 3 months, and then we give them a break from that point. I like to give patients a break from 3 to 6 months because that's when that collagen is really peaking, and then bringing them back and reassessing the progress that we've made. At that point, if the patient is thrilled with their results, then we'll go ahead and stop there and consider retreating maybe at 12-month mark. But I've had some patients come back and say, you know what, these results look great, but I really want to keep building. And so we would then start another round. So again, we've given them 3 monthly treatments with a break for 3 months, and then we restart another round of 3. Smooth threads are incredibly safe when placed properly in the proper plane. Basically, the complications that you might see are bruising and swelling. Of course, that can happen anytime that we're using needles in a patient's face. But other than that, there's no risk for occlusion or compression like we may rarely see with dermal filler, but still is a complication nonetheless. And so a lot of patients like this approach. They feel like it's a little bit more natural. It's kickstarting their body to do what it should be doing anyway. And so just consenting with the patient, they know bruising and swelling is common, perhaps plan ahead. They're not doing these anytime before a special event in the chances that they do get some bruising. But overall, they're incredibly safe. So you can see here my treatment planning for the neck is sort of a ladder approach. And she's really trying to tighten some tissue after a significant amount of weight loss. And so she has a little bit of laxity in the neck. And so I've created this ladder pattern, just sort of packing these threads in close together in the area of concern. And then I have a little bit on a more of an oblique fashion on the lateral aspects of her neck. We're going to stimulate collagen about 1.5 millimeters from where your thread is placed. And so you want to make sure that they're placed closely together so that way you get nice, even collagen production and in turn, some skin tightening for this particular case. Of course, there are many different indications for smooth threads. In addition to skin tightening, we also can use for volume loss. We can use for acne scarring. We can use for just any sort of scarring in general. Necklace lines in the neck. They're great for nasolabial folds and marionette lines to, again, restore some lost collagen and hopefully tighten and improve that area. And so the beauty of smooth threads, I always say, is there's really no right or wrong pattern. It's whatever you feel is going to give you the best results by sort of making sure that you're getting an appropriate amount of threads in your treatment area to deliver the best results possible. So we offer VSoft Lift trainings with the AAFE, PDO Smooth Threads, both virtually and live courses in person, and we hope to see you at a course sometime soon.